I'm Dr. Lena Popovic, and after 30 plus years in medical practice, I realised there's a lot missing from modern medicine. Education is more powerful than medication, and our decisions have more impact than our DNA. Today's health headline is Microbes Mess with Our Genes. I haven't forgotten about today's brain booster. I'm saving it for a treat at the end, so stay with me. Did you know that you have a gene called the guardian gene? I do too. We all have this gene. Its official name is EP15, and it encodes a protein called P53. And this protein protects our DNA. It spots damage in our cells, it stops mutations, and it triggers cells to die if their DNA is beyond repair. And these processes help to protect us from cancer and autoimmune diseases, including type 1 diabetes. And it turns out that our microbes interact with this gene and influence how it behaves through a process called epigenetics. Epigenetics refers to the ability of our genes to be turned on or off by factors in our environment, our diet, and our microbes, without there being any changes to our underlying DNA. And this is not the only gene affected by our microbes. Our microbes mess with many of our genes. But in relation to this particular gene, when mice are given antibiotics within the first 6 weeks of their life, they lose the protective effect of this gene and they develop type 1 diabetes. Even when the babies weren't given antibiotics themselves, but their mothers received antibiotics in the first 10 days before giving birth, the babies still developed diabetes. However, when the antibiotics were delayed until after 6 weeks of age, the gene was able to do its job and stop the mice getting diabetes. What this illustrates is that gut bacteria are needed to activate this gene, and there's a critical window early in life when this activation needs to happen. And when we look at the data on humans, babies who receive antibiotics within the first 2 years of life, or whose mothers received antibiotics late in pregnancy, have a high risk of developing autoimmune diseases, allergies, asthma, diabetes, and obesity. Now, this is not about making mothers feel guilty about having had antibiotics or giving them to their children. Antibiotics save lives. The take-home message is that gut bugs are critical to our health even before we're born. And that means we need to use antibiotics, and in fact any medications, only when absolutely necessary. We used to think it was only antibiotics that affected our microbiota. It turns out that hundreds of drugs can influence the metabolites that our microbes produce. And conversely, different gut bugs can lead to different responses to the same medication. More on all this later. For now, let's look at a range of unexpected circumstances that affect our microbiome and therefore our overall health. So what does a healthy microbiome look like? So far, we only have two broad principles that define a healthy microbiome. 1, diversity, and 2, specificity. In other words, the more different species we have in our gut and on our skin and in our sinuses, the healthier we tend to be. And having more lactobacilli, bifidobacteria, and Akkermansia, among others, also seems to be linked to better health. That's it. That's all we can say with any degree of certainty. And even that information might change as we learn more about our gut and its resident microbes. We are starting to link the absence of specific species to specific diseases, such as depression, anxiety, MS, multiple sclerosis, ulcerative colitis, Crohn's disease, Parkinson's, and even Alzheimer's. And makers of probiotic supplements are really monopolising on this, and they're suggesting that if you consume these species, you'll improve your symptoms. And that might be the case, but it's still not cut and dried. Because it's really difficult to prove that the lack of a single bacterium on its own causes a disease. Nonetheless, scientists have mapped out distinct microbial deficits that disrupt the gut-brain axis, degrade the intestinal barrier, and trigger systemic inflammation to varying degrees, thereby predisposing us to developing these diseases. By the way, do you know where the phrase cut and dried comes from? In the 1700s, before modern pharmacies, herbalists would harvest medicinal plants, cut them down, and leave them out to dry. Once they were cut and dried, they were ready for sale, and their use was completely settled. How about that? The other origin I've heard, but I don't like it as much because it's not medical, is that wood that had been chopped, i.e. cut, and seasoned, i.e. dried, was ready for immediate use and required no further preparation or effort. But I digress. So how do we maximise our chances of having a diverse microbiome that includes plenty of lactobacilli, bifidobacteria, and Akkermansia? Let's start at the very start. Were you born by vaginal delivery or caesarean section? During pregnancy, the microbes in a mother's gut and vagina undergo changes. Some species become more prevalent, some less prevalent. And the organisms that start to flourish have two roles. They help prepare mum's body for birth, and they're getting ready to be transferred to the baby as it passes through the birth canal. This is known as microbial seeding. And these microbes act as the fundamental pioneer species that rapidly colonise the baby's digestive tract. However, if a baby is born by caesarean section, it picks up a completely different cocktail of microorganisms. It doesn't receive mainly bifidobacteria, Bacteroides, and lactobacilli found in mum's gut and birth canal. Instead, it gets populated by skin microorganisms and bacteria that are floating around in the air of the operating theatre. And these other bacteria have a different effect on the baby's immune system and metabolism. And they're associated with a 20% increased risk of asthma and type 1 diabetes, along with a higher chance of autoimmune diseases, gut disorders, and obesity. Again, this is not about feeling guilty if you had to give birth by caesarean. Almost 1/3 of Australian babies are delivered by C-section, and in many cases the procedure is life-saving. But in some cases, it's the mother's or doctor's personal preference. Or it's done just in case there are complications with a vaginal delivery. We now realise this comes at a cost. There is a significant effect on the baby's founding microbes, and this needs to be considered when deciding on the best mode of delivery in each individual case. And there's exciting news on the horizon. To improve the health of babies delivered by C-section, obstetricians are trying a new technique. In the hour before the caesarean, they place a small piece of sterile gauze in the mother's vagina to soak up the bacteria-rich fluids. Then, as soon as the baby is delivered, the doctor passes the gauze through the baby's mouth and over their face and over their entire body. Because the aim is to inoculate the baby with the microbes it would have received if it had passed through the birth canal. And it works. The gut bugs in the swabbed caesarean baby resemble those of a naturally delivered baby. I really hope this soon becomes standard practice all over the world. But please don't try it at home. Before the swabbing, mothers need to be screened to rule out any infections they could inadvertently pass on to their child. So my message is, become a wary consumer of modern medical practices. If you're pregnant and might need a caesarean, speak to your obstetrician about how you can give your baby the bugs it needs for an optimally healthy start in life. The next step to a healthy microbiome is to have immediate skin-to-skin contact between mother and baby. This allows for the transfer of skin bacteria from mother to baby, which is also important for hormonal and biological processes. And skin-to-skin contact also has lots of other benefits. It stimulates the release of oxytocin, the calming and cuddle hormone. It dampens down cortisol, the stress hormone that was produced during labour in both mother and baby. It helps regulate the baby's breathing and blood sugar levels. It reduces crying. It warms the baby if it's cold, because the mother's skin will automatically warm up in response. And immediate skin-to-skin contact also facilitates the establishment of breastfeeding. Which brings us to the next question. Were you breastfed? Breastfeeding provides as many as 600 different species of desirable bacteria. Some come from breast milk itself, others from breast tissue. Breast milk also contains unique carbohydrates called human milk oligosaccharides, HMOs. And for years, scientists couldn't work out why they were one of the main components of breast milk, because the baby can't digest them. We now know that HMOs are not there to feed the baby. They're there to feed Bifidobacterium infantis, which is a foundational species in healthy babies. To date, more than 200 different HMOs have been identified, and none of these are present in infant formulas. Urea was another breast milk enigma. Urea is typically known as a waste product in urine, but when ingested by the baby through breast milk, it passes completely intact into the digestive tract, where it acts as a selective food source for another highly beneficial pioneer gut bacteria called Bifidobacterium longum. And breast milk provides antibodies and immune cells that help the baby develop a robust immune system that neither overreacts nor underreacts. And so obviously this reduces a child's susceptibility to infections and autoimmune diseases. If breastfeeding is a struggle, any amount of breast milk is better than no breast milk, because studies show that infants who are mixed fed have an intermediate microbiome between that of exclusively breastfed and exclusively formula-fed babies. Then you want to get yourself some older siblings. Growing up with older siblings is one of the most effective natural ways to boost a child's early microbiome. For decades, epidemiologists noticed that children from larger families had a much lower risk of developing asthma, eczema, and food allergies. And modern genetic sequencing has finally revealed the mechanism. Older siblings act as highly effective vectors for microbial transmission, thereby accelerating the development of a baby's internal ecosystem and providing it with greater microbial diversity. Older siblings constantly introduce a vast array of outside microbes into the household environment, and by sharing toys, playing, any form of close contact, even tracking dirt in from daycare or school, older siblings constantly pass beneficial bacteria down to the baby. And babies naturally go through this chaotic transitional microbiome phase where they're acquiring as many good bugs as they can. And a landmark clinical trial published in the Journal of Allergy and Clinical Immunology showed that babies with older brothers and sisters develop a mature adult-like gut microbiome significantly faster than only children. And this rapid maturation safely pushes the baby's gut past its most vulnerable, unstable developmental stages. And a very recent study, published only this year in 2026 in Nature Communications, discovered that older siblings, wait for this, it's such good news, older siblings can actually repair a baby's microbiome after a caesarean section. How good is that? C-section infants with older siblings showed dramatically higher microbiome restoration scores by 1 year of age, meaning close contact with a sibling effectively corrected the microbial deficit caused by surgical delivery. So go and thank your older siblings right now for the great things they've done for your gut. Next question. Did you play outside in the dirt when you were a child? Getting muddy directly introduces a massive variety of microscopic life that trains our immune system and strengthens our gut. A landmark 2020 study, published in Science Advances, demonstrated that modifying a child's play environment has immediate measurable effects on their biology. It was called the Green Playroom Trial. Researchers replaced standard urban gravel yards at daycare centres with natural forest floors, sod and soil. Within just 28 days, 1 month, children who played in the natural soil showed a massive increase in the diversity of beneficial bacteria on their skin and a highly diversified gut microbiome. The same study showed that this dirt-driven microbial shift changes blood chemistry. Children who played in the soil showed a significant increase in T regulatory cells and an uptick in interleukin 10, a critical anti-inflammatory signaling protein. So this exposure fundamentally trains the immune system to stay calm and lowers the risk of autoimmune conditions, asthma and severe allergies. Next question. Did you have a pet dog or cat? When it comes to establishing a diverse, healthy childhood microbiome and reducing your risk of asthma, eczema and allergies, cats are good, but dogs are even better. Why? The difference comes down to differences between the behaviour of cats and dogs, the different microbes that dogs and cats carry, and the different lifestyle changes that cats and dogs induce upon human households. Dogs, for instance, they're active outdoor animals. They physically drag the natural world and its microorganisms into the home. And one study found that families with dogs have 42% more diverse microbes on their household surfaces and pillowcases than pet-free homes. This is a good thing. Meanwhile, having a cat in the house made almost no difference to the diversity of household dust bacteria. And that's because cats are fastidiously clean animals. They spend up to half of their waking hours grooming themselves, and their saliva contains specific antimicrobial enzymes meant to clean their fur, so they're not going to transfer nearly as many bugs to us. Dogs, by contrast, lick children everywhere. Faces, hands, toys. So that introduces unique non-pathogenic canine saliva microbes directly to the child. Another interesting finding is that immune cells are trained by recognizing ancient environmental triggers. And because humans domesticated dogs thousands of years before cats, our immune systems are uniquely primed to respond positively to canine-associated bacteria. When a child's immune system detects passing dog-associated microbes, it triggers beneficial immune development pathways, teaching the body to tolerate harmless environmental inputs rather than triggering an allergic reaction. Large studies have tracked the stool profiles of thousands of babies and found that infants exposed to dogs, even indirectly during pregnancy, had a massive boost in two specific gut bacteria, Ruminococcus and Oscillospira. And these specific bacterial types are strongly linked to a lower risk of childhood obesity, as well as low risk of eczema and low risk of food allergies. Cats, on the other hand, didn't boost levels of these bacteria. And of course, dog-owning families spend a lot more time walking outdoors, visiting green spaces, throwing balls around in public parks, and the increased outdoor exposure ensures that both parents and children are breathing in richer, more diverse airborne microbes than families who keep indoor-only cats. But here's something interesting. The protective power of cats spikes dramatically when they're part of a multi-pet home. A major Swedish study, supported by Asthma Australia, tracked a dose-dependent response. Growing up with a combination of cats and dogs simultaneously creates a mini farm effect, and it dramatically lowers the rates of asthma, hay fever, and eczema compared to living with just one animal. And the way that cats protect children, even if it's just one cat on its own, is immunologically unique compared to dogs. While dogs modify the home microbiome through outdoor dirt, cats provide protection through high allergen exposure. In other words, growing up with a cat exposes an infant to a continuously high dose of specific cat proteins, which shifts their immune system into a state of tolerance, which blunts allergic reactions later in life. Now, there is one major caveat regarding cats and asthma. If a child does not possess an inherited genetic predisposition to cat allergies, having a cat is highly protective against asthma. But for a small subset of children who are genetically prone to pet sensitization, early exposure to a cat can sometimes exacerbate respiratory symptoms rather than prevent them. And if someone in the house already has asthma, they might not be able to have either a dog or a cat. Individual differences between us will always play a role in how we respond to anything. Next question. Was your mother severely stressed while she was pregnant? High levels of maternal stress reduces vaginal lactobacilli and gut bifidobacteria, which obviously alters the microbial environment a mother passes down to her child. This is not good because bifidobacteria are the bacteria needed to digest breast milk and establish a healthy gut barrier. Instead, babies born to stressed mothers were found to have a high relative abundance of potential opportunistic pathogens, i.e. microbes that can disrupt good gut function. Prenatal stress also changes the fetal environment through the placenta. High levels of maternal cortisol and pro-inflammatory chemicals called cytokines change the expression of genes in the fetal intestine, which makes the baby's gut wall more reactive to inflammation before any live microbes even arrive, so the baby's gut tissue isn't as welcoming to beneficial bacteria. And because early gut microbes are responsible for producing neurotransmitters, a stress-disrupted infant microbiome has been found to increase the risk of depression, anxiety, other psychiatric disorders, and autism, especially in boys. Stress at any time in our life wreaks havoc on our microbiome. Childhood abuse or severe trauma, even up to the age of 20 years, changes the chemical composition of our gut, which changes the composition of our gut microbes, which changes the chemicals, i.e. metabolites, they produce. And many of these metabolites include neurotransmitters and inflammatory molecules that can travel to our brain and increase our susceptibility to mental health issues, often accompanied by bowel problems. So trauma at any time can disrupt our gut microbiome, but the first 20 years of life are when it seems to be the most vulnerable. Experiences like being bullied make the blood-brain barrier leaky, which means that substances that should not be entering the brain get in. Research conducted on mice who were subjected to the human equivalent of bullying found that up to 30% of blood vessels, lining the blood-brain barrier showed signs of breaches in a region of the brain called the nucleus accumbens, which is involved in emotional regulation. So once again, this leads to brain inflammation and an increased vulnerability to depression, anxiety, and other mental health issues. So basically, anything that threatens our sense of self-worth, any severe social stresses, a hostile work environment, domestic violence, even body image issues can produce similar negative effects on our microbiome. Now, I have to tell you about a very interesting experiment that was conducted by scientists from Georgia State University in Atlanta. And the scientists wanted to answer two questions. One, does conflict affect our microbiome? You can see why I was particularly interested in the study. And two, does it make a difference whether you're the winner or the loser of that conflict? So they looked at the behaviour of hamsters who compete to establish hierarchies and end up with some animals being dominant and others subordinate, our equivalent of winners and losers. At different stages of conflict, the scientists examined their stools to see what was happening to their microbes. And they predicted that the losers would be worse off in terms of their gut bugs because losing results in more stress hormone production. What did they find? After conflict, whether or not you were a winner or loser, you lost microbial diversity, which you know is not a good thing. But the bacterial species that were impacted were different in winners and losers. Either way, they were negatively affected. And even a single exposure to social stress causes a change in the gut microbiota, and the change gets bigger after every argument. And then there was a really surprising twist to the story. This actually makes my hair stand on end. When the researchers looked at the populations of gut bacteria in the hamsters before the conflict, they found that different species of gut bugs were predictive of whether the hamster would become dominant or subordinate. It really makes you wonder who's running the show of our lives. The bottom line is that severe stress is just as damaging to our gut, if not more damaging, than a poor diet. And that's a really important point because we are so hyper-focused on the perfect gut-friendly diet or the perfect balance of pre and probiotics. But that might not be the answer. Could be eating the perfect diet. But if you're in a demoralizing job or getting bullied or in an abusive relationship, your gut is suffering. The good news, there always has to be good news, is that it is a two-way street. It isn't just our gut bugs that influence our brain. Our brain and patterns of thinking influence our gut. That means psychological interventions that improve our mental health also improve our gut health. A region of the brain, known as the prefrontal cortex, gives us the ability to override altered brain circuits and learn new behaviours that create new circuits that send new information to our gut that can start to bring about healing. What's missing from modern medicine is recognising that most medicines mess with our microbes, not just antibiotics. While antibiotics are the most well-known microbial disruptors, research shows that lots and lots of common non-antibiotic drugs also significantly alter microbial composition and diversity for the worse. But since antibiotics are the biggest blight on our bugs, let's start there. 61-year-old Mabel, not her real name, but I'm preserving doctor-patient confidentiality, so we'll call her Mabel, had been treated with antibiotics for pneumonia. The antibiotics cured her chest infection, but unfortunately, they also wiped out many of the good microbes, symbionts, in her gut, and as a result, a very nasty pathobiont called Clostridium difficile, abbreviated C. diff, started to breed like wildfire and took over her gut. Mabel suffered from intractable diarrhea every 15 minutes of the day. She lost 27 kilograms, 60 pounds, and was so weak that she was confined to a wheelchair. Nothing the doctors tried had any effect, and she was actually close to death. So her gastroenterologist, Dr. Karutz from the University of Minnesota, tried a last resort. He gave her a bowel flush. Then, using a colonoscope, he collected 25 grams of feces from the gut of her healthy husband of 44 years, mixed it with 300 ml of water, and squirted it from a colonoscope into her right colon. The very next day, Mabel's diarrhea stopped. The day after that, she had her first solid bowel motion in 8 months, and day by day she continued to improve. 1 month later, the Clostridium difficile was completely out of her system, and she made a full recovery. Welcome to the medicine of the future. Poo transplants, known more technically as fecal microbiota transplants, FMT, or human probiotic infusions, or live biotherapeutics, or bacteriotherapy, or transfusion. Okay, I just made that one up. Or poobiotics. I made that one up too. But the other names are all for real. And there are 2 more. Crapsules and poop pills. Not very popular because people don't like swallowing something that came out of someone else's bottom. But this is not a new idea. Cattle farmers have been using what they call fecal transfer for centuries. When cows change their diet, they can get indigestion. And farmers treat this by sucking the fluid out of the stomach of a healthy cow and feeding it to the sick cow. Back in the 1950s, people were dying from a gut disease called pseudomembranous colitis, so named because the colon is inflamed and has fake membranes on its inner walls. The symptoms are fever, abdominal pain, diarrhea, and in severe cases, the death rate was 75%. Now, doctors guessed that the patient's gut bacteria had changed and that was the cause of the problem, but they had no way of knowing for certain because they didn't have the technology to identify microorganisms. So they took a punt at what they termed resetting the bacteria of the sick person by infusing their colon with feces from a healthy person. And hey presto, many patients made miraculous recoveries. 70 years later, fecal transplants are making a comeback. And it's nothing short of a miracle. Studies in mice have found that if you transplant the poo of a slim mouse into the gut of a fat mouse, the fat mouse will lose weight. And vice versa. You can make a slim mouse fat by giving it the poo of an obese mouse. In humans, fecal transplants are now being tested as potential treatments for various gastrointestinal disorders such as irritable bowel syndrome, Crohn's disease, and ulcerative colitis, as well as autoimmune diseases, type 2 diabetes, arthritis, MS, autism, and even neurological conditions. In Australia, fecal microbial transplants are happening, but they are very strictly regulated by the Therapeutic Goods Administration, TGA, which mandates that FMT products must be included in the Australian Register of Therapeutic Goods like drugs. So because of these tight medical and safety regulations, treatment outside clinical trials is usually only approved for recurrent or refractory C. diff, as in the case of Mabel. Some specialist centres are also authorised to perform FMT for the inflammatory bowel diseases Crohn's, and ulcerative colitis. And apparently, there's a high demand for donors because it's hard work, though I'd have hoped it was soft work. It's actually more difficult to be accepted as a poo donor than it is to be a blood donor. 70% of people are rejected because the criteria are very, very stringent. You can't have taken antibiotics, antacids, or a range of other medications in the last 2 years. You can't have any bowel issues yourself. You can't have an autoimmune disorder. You can't have travelled to a third world country in the last 2 years. The list goes on and on. My partner keeps telling me I should be a donor because I'm full of it. But I'm too scared to offer them my stools because I don't want to be told my shit's not good enough. Uh-oh, does that word mean that this podcast will be censored? I hope not. Anyway, if you do make the cut, you get paid very well because it's demanding work. You have to deliver a fresh specimen to the clinic every morning and it's used that day. When it becomes mainstream, I wonder what the slogan will be. You know, like they have give blood signs? Will we start to see give a shit signs? Okay, enough crudeness. The point I was making was that antibiotics don't just kill pathogens. They also wipe out our good bacteria. And by now you'll realise that this compromises every aspect of our health. Babies given antibiotics in the first 2 years of life have a high risk of everything: asthma, allergies, autoimmune diseases, type 1 and 2 diabetes, obesity and gut problems. Women given antibiotics in the third trimester of pregnancy give birth to babies with an increased risk of everything I've just mentioned because it reduces the number of and diversity of bacteria they receive during delivery. So the first 2 to 3 years of life are the most important time to avoid antibiotics unless you're facing a life-threatening infection. But even as adults, it can take months, even years, to re-establish our beneficial bacteria after a single course of antibiotics. The other issue is that our relationship with antibiotics has become an arms race. The more we use and develop antibiotics, the better the harmful bacteria become in resisting them. And the way it happens is that when you get a bacterial infection, most of the bacteria will be sensitive to a specific antibiotic and get killed when you take the medication, and you'll recover. But there are often a few hardy bacteria that survive. They're the resistant ones. And the resistant ones can be passed on to someone else. And when they multiply, they can also transfer their resistant genes to other bacteria. So the next person won't get better with the same antibiotic. So it isn't people that become resistant to the effect of antibiotics. It's the bacteria themselves that change in order to protect themselves. I thought I'd better clarify that because I've actually had patients tell me, oh, I'm fine with antibiotics. I'm not resistant to them. And I have to tell them, that's not what I'm worried about. I know you're not resistant to antibiotics. It's the bacteria in your lungs that might be resistant to antibiotics. And Australia is consistently ranked in the world's top 10 highest antibiotic users out of comparable European and OECD countries. But I am relieved to say we are slowly demonstrating a downward trend. Because if we continue to use antibiotics when we don't need them, they won't work in the future when we do need them. So what can you do to help the situation? Don't use antibiotics for coughs, colds, and runny noses because more than 80% of throat infections are caused by viruses against which antibiotics have no effect. If your doctor wants to prescribe you antibiotics for something, ask if they are really necessary or if he or she is prescribing them to you just in case you need them. Don't subscribe to the just-in-case philosophy. Be vigilant to worsening symptoms, but even more importantly, address the conflict that might have led to the condition. Remembering that by conflict, I mean conflict with your physical, psychological, or emotional needs, not just overt conflict with another person. If you do need antibiotics, always finish the course unless you get an allergic reaction, because not finishing gives bacteria more opportunity to develop resistance. Having said that, don't take antibiotics for any longer than necessary either. The other big thing that's contributing to antibiotic resistance is that some farmers feed their livestock with antibiotics to stop them getting sick from overcrowded conditions. And in the 1940s, it was also discovered that low-dose antibiotics added to chick feed enhanced their growth. So some farmers are also using antibiotics to speed up the fattening of cows, pigs and poultry in order to get their animals to market more quickly. This is a terrible misuse of antibiotics because the low dose gives bacteria all the more time and opportunity to develop resistance. And if taking antibiotics fattens livestock, taking antibiotics might also fatten us. Evidence is also accumulating that recurrent antibiotic use is linked to a modest increase in the risk of several cancers, most notably colorectal, lung, pancreas, and breast cancers. The key words here are recurrent use of antibiotics and modest increase. So please don't panic if you've had a lot of antibiotics throughout your life. It does not mean you will get cancer. And by the end of this podcast episode, you'll have a plan for healing your gut. And just for interest, the association with cancer is hypothesized to stem from antibiotic-induced gut dysbiosis, where the drugs disrupt the natural balance of the microbiome and therefore potentially promote chronic inflammation and tumour formation. And I think I just need to define the word dysbiosis. It specifically refers to an imbalance in the microorganisms, bacteria, fungi, viruses, and archaea living in your body. And that occurs when beneficial microbes decrease, harmful ones overgrow, or overall microbial diversity is lost. Okay, enough doom and gloom about antibiotics. What other drugs disrupt our bugs? i.e., which other medications are known to be microbial disruptors?
I'll answer that question in next week's episode because this has been another long health headline and what's missing from modern medicine segment. So you'll have some time to digest, pun intended, what you've discovered today before you receive your next exciting instalment of Gut Guidelines. And I apologise for my croaky voice. I've been doing a bit too much speaking lately.
Please note that this podcast is for general information purposes only. It does not constitute medical advice and is not intended to provide specific guidance for any particular situation. The use of this information is at the viewer and listener's own risk and is not a substitute for consulting a healthcare provider.